In this video, we're going to talk about the structure of heart. Heart, blood vessel, and the blood form circulatory system. In Chapter 18, we talk about the function and the structure of the blood. In this chapter, we're going to focus on structure and the function of the heart. Heart and the blood vessel form into cardiovascular system. There are two circulatory systems in the body. One is called the pulmonary circuit. The other one is called the systematic circuit. Pulmonary circuit is located on the right side of the heart. It carries blood to lungs for gas exchange and brings back the oxygen to heart. Systematic circuit is located on the left side of the heart. It supplies oxygenated blood to all tissues of the body, bringing the carbon dioxide, the containing blood, back to the heart. This figure shows the general schematic of the cardiovascular system. The pulmonary circuit is located within the thoracic cavity. The oxygen poor blood collected from the top of the body and the bottom part of the body will go to the heart on the right side and go to the lung. The oxygenated blood will go back to the left side of the heart, and that blood will be delivered to the body parts to bring oxygen to the tissues. Then the tissues and the oxygenated blood will exchange, and the CO2 containing blood will go back to the right side of the heart. Heart is located in mediastinum between lungs within the thoracic cavity. The inferior end of the heart is called apex. In adult, the heart is the size of a fist and it weighs about 10 ounces. The heart has several connective tissue to wrap around it. There's a double layer connective tissue called pericardial, and this pericardial is double layered. The superficial layer is a fibrous layer. The inner layer is a serous layer. Within these two layers, there are fluid filled. The heart is made by three layers of tissues. Epicardium, which is the outer layer of the heart. Myocardium, which is the major cardiac muscle. Then there's a smooth muscle layer called endocardium. These three layers forms the wall of the heart. The heart has four chambers. We have two atriums, left atrium, right atrium, two ventricles, left ventricle and the right ventricle. Atriums are two superior chambers receiving blood returning from the heart. Then the ventricles are two inferior chambers pump blood into arteries. Atrium and the ventricle on the same side is connected by valve. The right AV valve is a tricuspid valve. The left AV valve is two-cuspid valve. As you can see, there are two extensions come out from the valve. Between the two ventricles, there is a wall made by cardiac tissue called interventricular septum. The septum separates two ventricles. This slide shows the blood flow through the chamber. The oxygen poor blood collected from head and limb and other part of the bodies will enter the right atrium from superior vena cava and the inferior vena cava. This oxygen poor blood will pass the AV valve on the right side of the heart and enters into the right ventricle. The contraction of the right ventricle will pump the blood to the pulmonary artery. Then the pulmonary artery will take the blood to the lungs. In the lung, the oxygen poor blood will exchange with oxygen. Then the oxygen-rich blood will enter back to the heart through the left pulmonary veins. The oxygen-rich blood goes to the left atrium. Then the contraction of the left atrium will pump the blood to the left ventricle. Then the contraction of the left ventricle will pump the blood to aorta. Then the blood will go to the rest part of the body. The contraction of the heart, atrium and ventricle is regulated by the sympathetic and the parasympathetic nerve system. As we mentioned in the previous chapter, the sympathetic nervous system will make the heart rate goes up, then the parasympathetic nervous system will bring the heart rate back down. With the nerve regulation, cardiac muscle cell will produce membrane potential. The change of the membrane potential can be measured by electrophysiology graph, so we can see the depolarization or repolarization processes just as the skeletal muscle contraction. In the heart, there's a pacemaker called SA node, sinoatrial node. This pacemaker is regulated by the peripheral nerve system. The excitation of this node will send the nerve signals through the nerve bundles, then make the atrium or ventricle to contract. Similar to skeletal muscle, the contraction of the cardiac muscle is due to the opening and the close of sodium ions or potassium ions. If the membrane potential goes up, which means the inside of the cardiac muscle cell become positive, sodium channel will open. So sodium and the calcium, at this case, will both enter into the cardiac muscle cell to make the membrane potential become positive. While the contraction is over, the potassium channel will open, then potassium will outflow, then membrane potential will go back down. The contraction of atrium and the ventricle can be recorded by electrocardiogram. The P wave is the contraction of the atrium. When the atrium contracts, the P wave is produced. After the P wave, there's QRS complex. QRS complex represents the membrane potential changes when ventricle is contract. Then the T wave means ventricle become relaxed. Knowing what's a normal ECG is, it's easy to identify the abnormal heart functions. The figure B here shows ventricular fibrillation. The ventricle contraction is messed up. The contraction and the relaxation of atrium and the ventricle are due to the pressure difference of the blood. The blood will flow from a high pressure point to low pressure point. For example, using the left side of the heart. When ventricle relaxes and expands, its internal pressure falls. If the mitral valve is open, blood will flow from left atrium to left ventricle. When ventricle contracts, the internal pressure goes up, then the AV valves will close. The aortic level is pushed open, and the blood flows into aorta from left ventricle. The valves are opening one direction. The valves will not open two directions, so blood will not flow from ventricle to atrium. The blood will only flow from atrium to ventricle. It's a one-way flow. The pressure changes between the atrium and the ventricle is the reason for AV valves to open, and it's also the reason for the blood to flow from atrium to ventricle, then from ventricle to the either artery or veins. Any insufficiency of the valve or damage of the valve will produce the blood to flow backwards, then that is dangerous. The contraction of the atrium or ventricle can be heard through the sounds made by the heart. The first heart sound is louder and longer, occurs when the closure of the AV valve. The second sound is softer and sharper, occurs with the closure of the semilunar valve. And the third sound is rarely heard in people over 30s. The cardiac cycle has different phases. Ventricular filling, this is during the diastole stage. Isovolumeric contraction is during the systolic stage. Ventricular ejection is during systolic stage. Isovolumetric relaxation is during the diastolic stage. The entire cardiac cycle is completed in less than 1 second. In addition to sympathetic and parasympathetic nerve system regulation on the heart, there are other factors also affect the heart rate. For example, some neurotransmitters such as norepinephrine and acetylcholine some catecholamines such as epinephrine. They can all stimulate heart rate. Thyroid hormone also increases number of adrenergic receptors on the heart, so it's more responsive to adrenergic stimulation. Caffeine will inhibit the cyclic AMP breakdown and prolonging adrenergic effect to increase the heartbeat. In addition to monitor the heart rate, stroke volume is another factor needs to be monitored. There are 3 variables govern the stroke volume: preload, contractility, afterload. If increase the preload or contractility, then the increase of stroke volume will be observed. Increased afterload will decrease the stroke volume. Exercise can make the heart work harder and increases the cardiac output. There are several types of heart disease. Coronary artery disease is one type of heart disease. It's due to the constriction of coronary arteries. It could be accumulation of the lipid deposits within the artery wall. This disease begins when endothelium damaged by hypertension, diabetes, or other causes. Then the monocytes penetrate walls of damaged vessels and transform into macrophages. Platelets play a role to adhere to damaged areas and secrete platelet-derived growth factor to attack the immune cells. Then at the end, the artery will become smaller and smaller to stop the blood flow. The risk factor to cause COD including genetics, aging, or being male. Other risk factors including obesity, smoking, lack of exercise, anxious personality, stress, aggression, and diet. Treatment for CAD include the bypass, balloon, or insertion of a stent.